1. Which of the following is a key benefit of implementing an electronic health record (EHR) system in clinical education programs? A. Decreasing compliance oversight. B. Enhancing continuity of care. C. Eliminating the need for evaluation. D. Reducing patient engagement. 2. When designing adult learning modules for EHR training, which approach is most effective? A. Memorization of regulatory codes. B. Problem-centered case scenarios. C. Rote repetition of commands. D. Passive video observation only. 3. In evaluation methods for EHR use, which metric best assesses learner competency? A. Number of logins. B. Accuracy of patient data entry. C. Time spent on tutorials. D. Number of training sessions attended. 4. Which principle of curriculum development ensures EHR training is aligned with real-world practice? A. Ignoring user feedback. B. Needs-based instructional design. C. Uniform instruction without assessment. D. Eliminating role-based customization. 5. An educator designing an EHR curriculum should prioritize which instructional strategy for adult learners? A. Lecture-only delivery. E. Experiential learning with simulations. C. Restricting collaborative exercises. D. Memorization-based quizzes only. 6. Which communication strategy is most effective in mentoring staff struggling with EHR adoption? A. One-way technical instructions. B. Active listening and feedback. C. Ignoring user frustration. D. Sending lengthy compliance manuals. 7. During evaluation of EHR proficiency, which tool provides the most valid measurement? A. Random guessing tests. B. Role-based simulation scenarios. C. Attendance logs. D. Informal peer observations only. 8. To comply with HIPAA, EHR training should emphasize which area most strongly? A. Entertainment-focused exercises. B. Data confidentiality and security protocols. C. Memorization of employee schedules. D. Competitive speed challenges. 9. Which curriculum development model is best suited for creating EHR training modules? A. ADDIE. Analysis, design, development, implementation, evaluation. B. Drill and practice repetition. C. Unguided trial and error. D. Purely theoretical lectures. 10. Which mentoring approach is most effective for fostering long-term EHR adoption? A. Criticizing the stakes without guidance. B. Collaborative coaching and role modeling. C. Avoiding feedback sessions. D. Removing performance evaluations. 11. What is the primary purpose of role-based access training in EHR education? A. To restrict collaboration. B. To align responsibilities with system access. C. To limit clinical documentation. D. To reduce patient-centered care. 12. When evaluating communication effectiveness in EHR onboarding, which indicator is most meaningful? A. Learner satisfaction surveys. B. Reduced compliance audits. C. Shorter system update times. D. Decreased need for leadership support. 13. Which teaching strategy best supports adult learners adapting to EHR updates? A. Passive observation. B. Scenario-based learning. C. Restricting practice sessions. D. Excluding hands-on engagement. 14. What is the primary regulatory requirement for maintaining patient safety within EHR systems? A. Transparent access to all records. B. Ensuring accurate, timely documentation. C. Reducing interdisciplinary collaboration. D. Eliminating access audits. 15. In curriculum planning, which principle ensures EHR training is sustainable over time? A. One-time delivery without updates. B. Continuous improvement with feedback integration. C. Standardized delivery ignoring new regulations. D. Sole reliance on outdated modules. 16. Which evaluation technique most effectively assesses higher-order thinking in EHR use? A. Multiple choice recall tests. B. Case study analysis. C. Counting login attempts. D. Passive observation. 17. What communication barrier often hinders successful EHR implementation? A. Transparent feedback loops. B. Resistance due to unclear expectations. C. Inclusive dialogue with users. D. Continuous mentorship programs. 18. In mentoring new EHR users, which practice increases skill retention? A. Immediate practice after demonstration. B. Delaying practice until weeks later. C. Removing opportunities for error. D. Restricting access until training completion. 19. Which principle of adult learning is most applicable to EHR training? A. Learning must be self-directed and practical. B. Learning should be entirely instructor-driven. C. Learning should avoid problem-solving. D. Learning should ignore prior experiences. 20. Which curriculum design step ensures compliance requirements are included in EHR training? A. Conducting a regulatory needs assessment. B. Ignoring legal standards. C. Prioritizing entertainment modules. D. Limiting audit procedures. 21. Which evaluation method best identifies gaps in EHR training effectiveness? A. Formative assessments during training. A. Unmonitored practice sessions. C. Post-training memory recall. D. Annual compliance audits only. 22. What is the most effective communication method for clarifying regulatory changes in EHR documentation? A. Complex legal jargon emails. B. Simplified structured briefings. C. Avoiding direct communication. D. Delegating updates to peers only. 23. Which mentoring activity supports knowledge transfer for EHR best practices? A. Shadowing experienced users. B. Working in isolation. C. Ignoring performance differences. D. Avoiding collaborative discussions. 24. Which instructional design element supports ongoing compliance in EHR training? A. Incorporating case-based compliance scenarios. B. Removing regulatory updates. C. Limiting documentation practice. D. Avoiding real-world context. 25. Which evaluation principle ensures fairness in EHR training assessments? A. Using objective performance criteria. B. Applying random scoring. C. Relying only on self-reports. Ignoring individual differences. 26. In adult education, what is the role of reflection in EHR training? A. To encourage learners to connect theory to practice. B. To reduce learner autonomy. C. To memorize error codes. D. To eliminate problem solving. 27. Which communication strategy builds learner confidence in EHR training? A. Constructive feedback with encouragement. B. Negative criticism without solutions. C. Ignoring learner progress. D. Overloading learners with regulations. 28. In mentoring relationships, which characteristic is most critical for EHR adoption success? A. patience and adaptability. B. Strict enforcement without support. C. Limiting learner questions. D. Prioritizing speed over accuracy. 29. What is the most significant regulatory risk in improper EHR use? A. HIPAA violations. B. Software updates. C. Lack of classroom engagement. D. Employee absenteeism. 30. Which curriculum planning activity ensures learners are prepared for real patient interactions? A. Simulated patient charting exercises. B. Memorization of compliance manuals. C. Listening to lectures only. D. Restricting clinical scenarios. 31. Which evaluation tool best measures long-term retention of EHR skills? A. Follow-up performance audits. B. Initial course completion rates. C. Training attendance numbers. D. Number of help desk calls. 32. What role does formative feedback play in EHR education? A. Guides learners toward improvement. B. Discourages self-assessment. C. Replaces summative evaluation. D. Eliminates mentoring needs. 33. Which principle of adult learning is violated if EHR training lacks relevance to daily tasks? A. Immediate applicability. B. Self-concept as learners. C. Problem orientation. D. Readiness to learn. 34. What is the most effective way to incorporate regulatory compliance into EHR training assessments? A. Embedding compliance criteria in simulation scoring. B. Using unrelated multiple-choice quizzes. C. Ignoring compliance standards. D. Testing only speed of data entry.